Hi, I'm Irma Botvin. I'm here with Dr. Larry Berkelhammer. Dr. Berkelhammer has researched mindfulness practices to increase mastery and well-being. I would like to ask you about another thing I saw on your website, which is authenticity and self-expression.
Yeah, this is a continuation of our discussion about authenticity. You know, I mentioned in the last interview that James Pennebaker had done this research on where they found people who journal their authentic feelings were healthier and happier. It is, however, important to be able to express our authentic feelings to other people. There are many ways to do this, many ways to work on this. But it's important to assertively express your needs using emotional awareness as your guide. So, for example, here's what you do. You want to tune into how am I feeling in the moment. How I'm feeling in the moment is going to help me know what my needs are. Basically, tune in how am I feeling in this moment, what is my need, and then just take a risk and express that to someone.
But it does get complicated because sometimes there are certain people in our lives where we don't have a tradition of having an openness where the other person is going to be able to hear that authenticity. So suppose you know that the other person is not going to receive it in the way you would want.
There are people out there, I mentioned earlier that being open and vulnerable is a sign of strength. However, there are people out there who are toxic to be around. You don't want to authentically self-express to those people. You want to keep your distance as much as possible from those people.
Yeah.
There have been studies where they found, especially in the early 90s, I remember, I think it might have been Margaret Kemeny and some other researchers in the early 90s at UCSF found that the ability to say no to a request correlated consistently with better health outcomes, authentic self-expression. In a number of studies of hospitalized inpatients, they found that the patients who the nurses considered to be a real pain in the ass, those patients were discharged earlier and did better in their recoveries.
So even though people didn't like them on staff, but they were healthier.
If you're popular with all the nurses, you're probably not, if you're popular with all the nurses in the hospital, you're probably not authentically expressing yourself. It's important to take risks because a major contributor to emotional distress is a lack of authenticity in interpersonal interactions. So you want to assertively, you want to practice assertively, practice absolutely being as assertive as possible in asking for what you want. Now, I'm not talking about being demanding, pushy, aggressive. I'm talking about being calm and assertive, asking for what you want. Being in touch with your true feelings, using I statements. If you do that, you won't be seen as aggressive, pushy. You'll be well received.
Well, that's the difference, isn't it? Aggression isn't like, you better do this for me, is aggressive, as opposed to, I'm feeling really tired right now. I'm wondering if you could shut the music off.
Rather than you need, with finger pointing, you need to, or you shouldn't. That doesn't go anywhere.
Right, okay. Okay. Well, thank you very much.
Thank you.